Hello and welcome to this virtual training session on social prescribing by Community360. I'm Jackie Fairweather and I manage the team of social prescriber link workers in Colchester. I'm going to give you some background information about Community360, our social prescribing journey so far, and then introduce you to some of the team who will cover partnership working, how you can refer to the service, and then we'll give you some real examples of people that we've supported and helped through My Social Prescription. So to give some background about Community360, we are an independent charity established in 1968 and we exist to assist members of the public, voluntary and community organisations by providing passionate, intelligent leadership in Colchester, Essex and beyond. We work with more than 400 charities, voluntary and community groups across Essex each year to assist them to continue their valuable work. We have a proven track record of establishing innovative ways of working to benefit public services, including developing the first social prescribing project in Essex. We also offer training and workshops around mental health, dementia and team management, and to assist people to set up and fund local groups. We understand the community and what is offered, and we identify gaps in provision. So what is social prescribing? Social prescribing is a process to help people aged 18 plus to make positive changes in their lives and within their communities by linking them to volunteering, activities, voluntary and community groups and public services that help them to feel more valued in their community, meet new people and make some positive changes to improve their health and well-being. At Community360, we have been social prescribing for 6 years now, and we've helped many people, a sample of which will be shown to you later in this presentation by Hannah. We are not clinicians or health professionals, but we understand our local community. We keep up to date with community services, ensuring that with the groups we signpost and refer to are current, bona fide and trusted. We focus on what is strong, not what is wrong with an individual. This is through asset-based community development. We have a wealth of knowledge and expertise across our teams. We access and populate a database of support services, and we join up and work with many partners and have an asset-based approach and focus to our work. Thank you for listening. I will now hand over to Paula, who will explain a bit more about our partnerships and working relationships.
Hello, I'm Paula Hockey and I'm a social prescribing link worker with Community360. Working in partnership. As social prescribing link workers, we work in partnership and collaboration with many organisations. We utilise the assets we have in the local community to support people who are referred to us. We signpost, make onward referrals and share information. Here are some examples of those we work with in the statutory and public sectors. North East Essex Clinical Commissioning Group, all 7 primary care networks and GP surgeries in Colchester, Essex County Council, Colchester Borough Council, the University of Essex through their V-Team and recent Wellbeing Through Social Prescribing project, Colchester General Hospital with our Home from Hospital support. We forge strong links and work with over 400 voluntary organisations and groups such as Open Road, Age Concern, Health in Mind, Phoenix Futures and Community Voluntary Services Tendering, as well as health and social care professionals including Anglia Community Enterprise, their district nursing and therapy teams, Essex Partnership University Trust, who refer people who have mental health or learning disabilities, GP care advisors who are aligned with surgeries, and community agents who support individuals in their homes.
Hi, my name is Georgina and I'm a social prescribing link worker, and I'll be discussing how to refer into social prescribing and what happens when a referral is received. There are several referral mechanisms into social prescribing, and these include a self-referral ages 18 plus via telephone or email. Family and friends can refer a person with consent. Professionals can call 01206 505 250 to speak with the social prescribing team. Professionals with an NHS email account can refer a person with their consent via a secure NHS portal at c360.socialprescribing@nhs.net. Professionals without an NHS email account can still send us a protected referral with an agreed password to msp@community360.org.uk. We also use several other referral platforms with external agencies and organisations. When a referral is received, this will be acknowledged by Community360 and all data will be securely stored on our database. The person will be contacted within 10 working days and a guided conversation will take place and health and well-being benchmarked through questionnaires such as outcome stars, which measure a person's progress before and after intervention, and depression screenings, which give an insight into whether an individual may be experiencing feelings of depression or anxiety. Community360 social prescribers will then use local asset maps to co-design solutions with the person and inform them about what is available. After the initial conversation, a letter or email will be sent containing local information relevant to the needs of the person. We will then have a follow-up conversation in approximately 3 weeks' time to check on their progress and offer further support. The C360 social prescriber will then review the outcome star to see what has been achieved and update our records. Moreover, with the person's permission, we can capture the social prescribing experience and outcomes and turn this into a case study to share and show others what support is available and what can be achieved. For people, the benefits of social prescribing can include changes in physical and mental health and well-being, changes in lifestyle behaviours and social functioning, changes to health service use, changes in emotional and cognitive skills, and in other areas such as community capital, education, employment, knowledge and skills.
Hi, my name's Hannah and I'm a social prescribing link worker. In this part of our video, I'll be explaining the why behind social prescribing by sharing some case studies of real-life people we have helped and supported. I have 3 case studies to share and I will finish on showing the quotes of people within our community. A winter warmth outreach event at an ACE rehab clinic where we were promoting our free packs to those in need. We were able to discuss support for Kim as she mentioned her son is on the autism spectrum and she was looking for inclusive fun activities and support for him as their recent group had shut. Through our research, we were able to find various inclusive social groups for her son, including trampolining and sports. Within our conversation, she also mentioned it can be difficult for them to travel as they were currently using taxis as her son can find public transport overstimulating. However, the taxis were becoming quite expensive. I was able to explain our community transport scheme, which we run here at Community360. This includes a membership fee of £15 a year and the costing for each trip is £3 for the first 3 miles and 50p for every mile after, with only an additional £1 for a carer to accompany. This was a much cheaper alternative for Kim and her family, making attending social groups much easier. Kim also mentioned not having a lot of time to herself or being able to meet new people or friends, and asked if we could recommend some social groups for her. Through our conversations, she suggested she would like a welcoming environment to meet people over a hot drink. I was able to give Kim the details of the cafe, Colchester and Friends events, run by Colchester Borough Council, which have a different meeting time and place Monday to Friday, making it easy to find something every day if needed. Unfortunately, shortly after our meeting, Kim and her family were advised to shield due to the pandemic. We were able to continue supporting Kim by regular welfare calls to ensure that her and her family were managing with the practical side of lockdown, but also her own well-being. Please see here a picture of one of our social prescribing link workers, Emmy, at one of our winter warmth outreach events. Here you can see some of the contents of the packs. Jack initially was referred to Community360 for support with food as he had been advised to shield during the pandemic. We were able to supply Jack with regular paid-for essential food packs. From this initial conversation, we were able to identify other areas Jack needed support with, such as befriending, financial, falls prevention and mental health. Jack was placed on our short-term befriending calls, but since has been referred to Essex Befriends for more long-term support. We were able to make a referral to a GP care advisor for a benefits check, as he explained he was often low on money. Since then, Jack is now receiving more money each week and has found something else he should have been claiming, which he was extremely happy with, as he was struggling to make ends meet. Jack also disclosed he was living with depression, so we were able to send some resources on support during COVID-19 and complete a depression screening. Within this depression screening, we were able to identify that Jack was already in contact with his GP regarding his mental health and was going through a referral to the IAPS service. In conversation, Jack mentioned he often had trips and falls around the home, a few resulting in having to go to hospital. I explained our slipper support programme, and he was resistant at first as he explained he was too young to wear slippers. But on our follow-up call, he laughed and told me he had not taken them off since getting them. He said, "Without people like you, people like me wouldn't know what to do or where to start." Please see here a pair of our slippers and also our slipper support poster. Ethel was first contacted by us during our Category A calls during the coronavirus pandemic. She was identified as vulnerable, and we had made calls to check on people's welfare and if they needed any support. Ethel was doing okay for practical things such as food and prescriptions, but from this conversation we were able to identify some other needs. Ethel is living with sight loss and has always got talking books from her local library in Stanway. She was always relied on this service, and even more so with coronavirus, as she was shielding. But unfortunately, the library closed due to COVID-19, which left her feeling very isolated and lonely. She had no way of finding out when and if the library would reopen. We found out when the library would reopen and also different options for getting talking books. As the library reopened, she was very happy to use their service again, but was also very thankful that she now has other options for getting them. Ethel has had several falls within the home, so we were able to do a falls risk assessment and recommended our slipper support, which she was very pleased with and grateful for. She has now been fitted with a new pair of non-slip slippers. We were also able to continue weekly welfare calls for Ethel during this period. She said, "He doesn't realise how much help he has given me." I will now share a written statement from one of our volunteers about his experience with Community360. I first came to Community360 from a charity, Health in Mind, which helped me find opportunities for me to find some activities to help me occupied during the days. My star worker advised me to try Community360 as they told me it would help me meet new people and make new friends and help me learn new skills. During my time with Community360, I've met and helped numerous people. I volunteer for the ICT part of Community360 that involves people from any age range coming in and getting help from the volunteers with any technical issue on their laptops, phones or tablets. I personally help people on my speciality subjects, which include social media, email and other technical needs. Even if people don't need technical help, people can just come in for a chat. Community360 has helped me become the person I am today, and I can't thank Community360 enough for helping and encouraging me to do things that I never would have done on my own. Community360 is a very friendly environment to be around, and the volunteers that help are also friendly too. Their staff are always happy to help if I need anything. They always offer with a warm smile on their faces, which makes it feel so great. Community360 don't just offer technical support, there are also other parts such as time bank, social prescription and lots more that people can sign up for. So all in all, Community360 is a great place to volunteer for. I will now be sharing some comments from people within our community and professionals. What fabulous service from Provide. You're doing an amazing job. We don't know what we would do without you guys. GP surgery. I thank you all from the bottom of my heart for your help and support in such horrible times. You're all doing an amazing job. Keep up your hard work. Female in her 30s. It is so humbling to know that there are people out there looking out for you. Male in his 60s. Your help has made a huge difference. GP Care Advisor. It is an unbelievable service, male in his 60s. I want to thank you and your team for the amazing work you are doing at the moment to help those more vulnerable than the rest of us. Such a huge challenge for us all in these times. Radiotherapist, Colchester General Hospital. You're so kind and I really do appreciate it. It really means a lot that people care. I forgot to say what I owe you for this help, so if you can let me know. Thank you again, means the world to me, male in his 30s. Thank you so much, I think you're doing a brilliant job, senior occupation therapist. You provided a lifeline for me, female in her 50s. Once I received the call, I didn't feel on my own anymore, male in his 60s. Thank you very much for listening to this training video. If you have any questions or you would like to speak to a member of our team, please call 01206 505 250 or the rest of our details on the screen. Thank you.